How do I know if metabolic dysfunction might be contributing to someone's mental health issues? This is things like inflammation, oxidative stress, and insulin resistance. My name is Dr. Ruth and I'm a board certified adult psychiatrist and a metabolic psychiatrist, meaning that I look at the overlap between mental health and metabolic health. So I'm going to look at both the patient's history as well as some objective measures like their physical exam and laboratory tests. So some clues in someone's history that there might be metabolic dysfunction would be what other medical conditions do they have? So things like PCOS, fatty liver disease, obesity, high blood pressure, high cholesterol, cardiovascular disease, stroke, chronic pain, and GI issues. These are all indicative of metabolic dysfunction. So that would point me in the direction of thinking this patient's mental health also likely has a component of metabolic dysfunction. And then I'm also going to listen to what they're reporting to me as far as symptoms. So when they're reporting things like brain fog, insomnia, hanger, frequent infections, recent weight gain, and pain, these again are all indicating metabolic dysfunction, inflammation, etc. So then I'm going to move on to more of the objective measures. So I'm going to look at the patient. Do they have central adiposity, meaning do they hold weight in their midsection? This is going to be indicative of insulin resistance. Are there notable skin changes? So things like eczema, rosacea, psoriasis, or maybe they've had a recent increase in skin darkening or frequent appearance of skin tags. That's indicative of insulin resistance as well. Do they have heavy breathing, especially in the context of obesity? This is going to make me think about sleep apnea. Are they generally puffy or is there notable swelling? I'm going to check their vitals, so look at their height, their weight, their blood pressure, their pulse. I'm also going to look at certain lab tests that can be indicative of inflammation or other metabolic issues. So this is going to include things like their lipid panel, which shows your good cholesterol, your bad cholesterol, and your triglycerides, your hemoglobin A1C, which shows the average blood sugar over the last 3 months, your comprehensive metabolic panel, which is going to look at your liver function, your kidney function, and your electrolytes. I'm going to look at inflammatory markers like ESR and CRP, as well as your vitamin levels to see if there might be some deficiencies that could be contributing. So things like vitamin D, folate, vitamin B12, and iron. There are lots of other tests that I could also order, but this is going to be kind of the bare minimum that I order when I start seeing someone. And the good thing is that if there's metabolic dysfunction, there's something you can do about it. And if you treat that underlying metabolic dysfunction, not only will your mental health symptoms improve, but all of these other symptoms and conditions will improve as well. If you have any questions about this, feel free to put in the comments below. Wishing you all the mental health today, and I'll see you in the next one.